Okay. Awesome. All right. For those of you watching the stream here, we are going to get started here momentarily, so bear with us. Excited to have you with us. We're going to be doing some testing here. All right. Let's see. All right, almost ready here. All right, if you're streaming, if you can give us a thumbs up or a good to go, something to let us know that you can see that. We'll get started here in just a moment. All right, thanks for being here. I'm going to turn on the recording here, and then this will be on in just a little bit. So if you are on Facebook and you have any questions, there we go. If you have any questions, what I want you to do is you can chat in the Facebook, on the Facebook page, and that will allow, and Casey will be moderating that chat. So everyone say hi to Casey. Because I'm giving the presentation, will only be giving the presentation. I won't see your questions or comments or chats while I'm doing this, but Casey will. And then when we get to the end, I will have questions. I'll answer any of those questions. So super, super glad that you've joined us. The reason that we're doing this workshop is if you look at the little guy in the glasses in the front, this is an older picture, but Josiah, our son, was born in 2006, and my wife's pregnancy for that was a very normal pregnancy, if you will. Didn't have any concerns. And then when we get to the hospital, this is before we knew we could have control over any sort of our birth plan. And what we found was that the hospital has a way that they normally do things. We weren't really aware of that. With our first child, our daughter, we just did what we thought good parents would do. And for our second child, we did the same thing, but there were some complications. And what happened was they ended up having to break my wife's water, and then they induced the delivery and made it go faster than it needed to. And we felt like that was kind of odd. We were concerned, but didn't really know what was happening or why that was an issue. And then what we found was there were a lot of health issues that our son Josiah had. In fact, the neonatologist told us that he wasn't going to survive. That was a really, really shocking situation for us. And we were scared and didn't know what to do or where to turn. And $16,000 later worth of tests that told us absolutely nothing. What we found with that was they couldn't find anything. Well, I'm going to tell you that Josiah's alive today. He's well. He's 14 years old and doing really, really well. But we did something unconventional when he was just a couple days old. And stay with me and I'll share with you what that was. So our vision for a workshop like this is very, very simple. The goal of Delivered is to ensure that women prepare their bodies and minds for birth so they can be their best when the moment arrives. And so their newborn babies, they are able to take their first breath in a way that allows them to develop as a healthy, happy child. So tonight, we're going to be going through 4 relatively straightforward steps. First, we're going to go through an education piece where you can learn what it is and why this is important. Then we want to go through an empowerment session. Then we want to encourage you as you make your plan and then enhance your fertility journey, your pregnancy journey, your delivery journey, or your raising healthy kiddos journey. So if you're watching this and you're a guy, hey man, thanks for joining. If you're watching this and you're a mom to be and you're not pregnant yet, thank you for joining. If you are pregnant and it's early in your pregnancy, amazing timing. That is just ideal. And if you're joining and you've already delivered and you've got teenagers at home, it still is very, very important information. So thank you for being here. This is going to be a life-changing experience for you and your family. So as we go through this first section, we're going to talk about the common path, if you will, that people go through when they're starting a family. And the question that I would ask you is, are babies today delivered or are they born? Now, some people may have experienced pregnancy and birth, and some this might be your first time. And so if you think about the typical common American birth today, you're probably seeing some sweaty mom with hair matted to her face and in a hospital with people running everywhere, and they're running into the hospital in the wheelchair maybe, and she's screaming, and you may see that. And honestly, it's really not that different. If you've been there, you know that it's really not that different. But we spend time planning our vacations. We spend time planning for retirement. We spend time planning where we want to go to school, or our weddings. And we go through all this planning, but oftentimes as parents, we just kind of get on the conveyor belt and don't plan what birth is going to be like. So are there going to be obstetricians on your journey, or prenatal chiropractors, or acupuncturists, or massage therapists, or reflexologists, nutritionists, naturopathic doctors? Who is going to be on this journey? And the truth is, you need to figure out what your birth plan looks like. Is it going to be the same or different as anyone else? Well, this is why this is really important, because we know that anytime there are augmented labors, 8 out of 10 births today are augmented in some fashion. That means it didn't just happen. So as we explore these, it involves rupturing membranes. That's breaking water, right? It means cervical ripening. That's where the cervix is not ready for delivery yet. It could be mechanical dilators to get the cervix to open up. It could be induction with Pitocin, which is an artificial form of the body's natural oxytocin, which softens the uterus. It could be an epidural. It could be an episiotomy, or a C-section, or forceps, or vacuums. But the point is, 8 out of 10 births today are augmented. They're assisted in some way. And the reason this matters is, think about what the body is designed to do. Now, I'm going to pause for a second and just remind you that I'm a man, and I've never experienced pregnancy or delivery, and realized that if it was left up to guys, we probably would never have kids. So what this isn't is some guy telling women what they need to do with their bodies. But what I am doing is pointing out to you that there are some things that definitely require your attention if you haven't yet delivered the next baby, so to speak. And so as the body prepares for delivery, the brain sends signals through the nervous system, and it lets mom's body know that baby is ready to be delivered. And so baby drops, water breaks eventually. The cervix softens and thins out. And so there's a passageway for baby to be born. But if the membranes get ruptured, if the water is broken, baby really wasn't ready to come out. And unless this is an emergency intervention, we have to look at whether there are risks. And just because it's the way we've always done it does not mean that it's risk-free or the right choice. And so there's cervical ripening, where they'll actually start applying pressure to the cervix to help it soften and get thinner, and they'll give them Pitocin. Well, what happens is, when mom's body is ready and baby is ready to be delivered, the body will send oxytocin, and that will naturally soften and thin the cervix. And so as contractions happen, baby's head is pushing more into a pillow, for example. But if it's not happening naturally, and if Pitocin is used instead of oxytocin, what happens is it's starting to thin the cervix, but it's not softening it, because the body isn't telling the cervix to do that. And so baby's actually getting pressed into the floor, the pelvic floor, into the uterus, and it's creating more trauma in the baby's upper neck. You're going to see momentarily why that's an issue. But there are some other risks to these, quote, routine interventions. So induction with Pitocin leads to decreased fetal heart rate. That's important to know. Harder and longer contractions, 2 times more likely to end in a C-section, a higher probability of requiring an epidural, and a reduced rate of instant breastfeeding. We're going to talk about this in just a moment as well. If we look at other routine interventions like epidurals, that leads to longer labor times and difficulty, 3 times the risk of severe perineal tear. That is a very, very dangerous situation for mom when she tears 3 times worse than she would have potentially without the epidural. 4 times greater chance of posterior presentation where baby is turned around backwards. You've heard about back labor. That's when baby's head is pushing into mom's tailbone. That is a 4 times higher risk with an epidural. And then there's a higher probability of instrumentation like vacuums or forceps, and there's an increased risk of pelvic problems later. When epidurals are used, moms have a much greater risk of urinary incontinence later. And so from the nervous system's point of view here, the nervous system is completely numb on mom from the waist down. And so that's obviously more comfortable, but that feedback loop is completely slowed down because of the epidural. And so it leads to other challenges. Well, Dr. Bruce Lipton, he's a molecular biologist, used to teach at Harvard Medical School, said you can't be in growth and protection at the same time. And so we have to know that going into this, balance of that nervous system is key. If we look at stress, if we're worried about planning, and if mom has a lot of trauma on her body, through this growth and development of baby, and then we start to add these toxic elements, really the nervous system is taking the brunt of this, and this is why this is so important to have this conversation. And so what's at stake needs to be addressed. I mean, as I mentioned before, we have to look at why this would be happening. And you might be thinking, well, hey, why in the world is a chiropractor talking about pregnancy and delivery? Well, that's because we work with the nervous system, both moms and dads and babies and kiddos as they start to grow and develop. And so as hormones initiate labor and we interrupt that, or that gets interrupted, if we leave this and don't address it, then there's significant birth trauma that can lead to further complications. For example, 1 in 4 children that result in this perfect storm. There's a perfect storm workshop we'll do talking about birth trauma specifically, sensory issues, ADHD, autism spectrum, and this is what's at stake. An improperly planned pregnancy, labor, delivery, first few weeks and months of life will almost definitely lead to these kiddos that are on the perfect storm situation. And so we look at kids in the perfect storm. 1 in 4 kids have allergies. That's an issue. Why is their body overreacting? 1 in 10 kids in the United States have asthma. 1 in 8 have ADHD, and 1 in 68 are on the autism spectrum. Then we look at things like childhood obesity rates, type 2 diabetes, learning and behavior difficulties, anxiety, prescription drug use, and other epidemics. Those are all on the rise in our kids, and we have to ask the question why. Well, this is how we're addressing that. So the question again is, do you have a plan to achieve your ideal birth? Now, if we look back at what we've talked about, we see that there are these normal ways, but we suggest that you look at this, and instead of looking at the more common path, we need to talk about the road less traveled. And so we want to show that there are options, and here is the road less traveled. So first of all, stay in control of your birth plan. That's what we suggest. Trust in the natural process. This is so incredibly important. It can't be overstated. We also want you to be more comfortable in your delivery environment. So there are a lot of options to discuss. We won't get into tons of detail tonight, but we do have a lot of resources. And this will make it more likely that you'll achieve your ideal plan. And then there's less trauma and lower odds of C-section. So I typically will talk to moms in groups because the common path that we discuss is not really the journey they want their child's birth to be on. But maybe you don't know which path you want to be on, or maybe you've already had kids and you want to know what to do. And we're going to get there. So stay with me. But when we look at a more natural birth through some of these points we're going to give you this evening, this is really, really, really helpful because it lowers the risk of respiratory complications. That's hugely important in both mom and baby. It stimulates the cardiovascular system in baby. It naturally provides protective bacteria. Baby benefits from hormonal surges, and there's a 20% lower risk of type 1 diabetes when we let the body's process do what it needs to do. We also are big proponents of people having home births. Now, we don't do anything with delivery ourselves here, but this is really important in light of the recent, pandemic. People are wanting to avoid hospitals, but that's not a terrible idea when we look at this. So non-hospital births are 4 times less likely to end in C-sections. 84% of women who planned out of the hospital births achieve their goal. So it's very, very common that if you plan it and you work your plan, that it can happen the way you envision it. Non-hospital births can still be covered by insurance and are considerably less expensive. Not that that matters as much when we're talking about growing our families, but it can be important nonetheless. So the question would be, which route is right for you? And here's the thing, it's your personal birth journey, and it can be somewhere in between. So you take the wheel, you're responsible for it, know your options, and make sure that you have confidence while you are mapping out your birth plan. Now, the next section we're moving into is the empowerment section. And this is one of my favorites because there's an African proverb that says, if you want to go fast, go alone. If you want to go far, go together. And so here are some benefits of having taken the wheel and assembling a birth team. Of course, you can have an OBGYN. Definitely have a prenatal chiropractor. So our team is super, super, super passionate about your spine, your nervous system, and baby's spine and nervous system, and your kid's spine and nervous system, that of your whole family. And you'll hear why that's important as we get into some of this other material. Yoga and exercise are huge. Make sure you've got people on your team that know that. Acupuncture is great. Massage is great. Family and friends are great. Midwives, doulas, birthing classes, nutritional support. Dr. Sarver on our team has amazing custom programs for nutrition support. And so we think that that is remarkable. But you can have anybody on your team be the captain of your team. It depends on what your goal is. And so what we realize is that, and this is a quote, we must remember that the mind-body phenomenon described in 19th century textbooks is no less true now than it was then. Most women need encouragement and companionship more than they need drugs. So having the right team is huge. This is our doctor team right here. And so that's myself, Dr. Kato, Dr. Sarver, and we are your delivered doctor team. We want to use our expertise to help you and your family achieve your full God-given potential. So what's amazing about some of our techniques, the Webster technique is very specific, it's non-invasive, it's extremely effective. In 13 years, we have never, ever, 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 ever had a baby born breech to one of our moms that comes in here. We've had breech presentation, but using Webster technique, we literally have never had a baby born breech, which is awesome. But we don't want you waiting till 36 or 38 weeks to come in because there are other things that need to be working properly with your nervous system. And so that's where chiropractic comes in. There are tons of benefits for you, mom. First of all, chiropractic care, the right program for moms to be. It prepares your pelvis for an easier pregnancy and birth. It removes tension on ligaments that support the uterus, like your round ligament and many others. And when that's got a lot of tension, that constrains baby. Baby doesn't move well, then there can be misshaped heads. There's all kinds of stuff that can happen. But when we get you properly cared for, that happens far less. It also, good prenatal chiropractic care reduces interference in your nervous system, mom, which is what's responsible for controlling blood vessels, glands, organs, hormones, immune system, cardiovascular system. Every single organ, tissue, gland, and cell in your body is controlled by your nervous system. And that also is controlling baby's growth and development. So your nervous system needs to be functioning at its highest level. And then it also allows, good care allows for an easier, safer birth and decreases the potential for intervention. That is so remarkable when intervention is not required. And for baby, it's really, really helpful because it removes, chiropractic care removes interference and allows for better baby development. It also allows more room to develop the head, the spine, the skeletal structures. It also allows baby to move into the best possible position, and then proper position decreases when when care is taking place, and that also leads to less of a risk for intervention. We also know that while you're pregnant, that proper baby and body position are huge, and that is achieved when we deliver good prenatal chiropractic care. We also notice that there's a huge decrease in that intrauterine constraint where baby can't move around. It decreases physical stress on mom's body. It increases vitality and energy, which is huge, and it decreases labor time, effort, and pain, and allows for a healthy baby. The nervous system is the master controller of all your organs, tissues, glands, and cells. And so that's why proper nervous system function is the absolute most critical foundational piece. And then spinal subluxations in mom cause nerve interference, which then puts stress on that nervous system. And that stress causes dysfunctional input to the reproductive organs. And now baby is not getting proper brain to body communication. And excessive stress or stress hormones may inhibit labor because it'll disrupt the oxytocin production and secretion. And so managing your physical, chemical, and emotional distress is vitally important. So then we look at what happens when the body is out of ease during delivery, when you say, just go ahead and you guys do what you need to do. If you look in the picture to the right, oftentimes that there will be forceps or extraction, vacuum extraction used because they are wanting baby to be delivered faster. But that can be very, very damaging to baby's head, spine, upper neck, nervous system. And this is important to point out because if there's that much stress on the nervous system, it leads to chronic illness in babies. And so we see things like colic and sleep issues. So these are things we see when there's trouble in baby's nervous system. So pay attention to this list, parents, because if you have kiddos that either are experiencing this or older kids who have experienced this in the past, this is so important. The first breath is the most important. And oftentimes when babies take their first breath, they already have nervous system damage. And nobody other than people who are trained to do this work are checking for that. But that will lead to kids who have colic, they deal with sleep issues. There's reflux and constipation. I've heard of 2-year-olds being given medications for reflux. Difficulty nursing, if baby's not latching on one side or both, that's a huge indication that there's upper neck disturbance. Torticollis, where the head is leaning to the side, or a misshaped head, plagiocephaly. ADHD and sensory disorders, major results of nervous system interference due to improper labor and delivery. Autism spectrum, ear infections, respiratory infections, allergies, eczema, motor and speech delays, asthma, allergies, autoimmune disorders. These are just a few things that develop the first, days, weeks, months, first couple years of life when the nervous system isn't working well. And in fact, 7 out of 8 babies that die of sudden infant death have spinal cord compression and nervous system damage at the very top of the spine. And so that's why it's so critically important to get checked before it's too late. And so balance is key. Our goal is to keep your child balanced and connected during those vital 3 years. As the twig is bent, so the tree grows. And so we want to make sure that your kids, their first few years in life are growing and developing amazingly well. Reducing stress is huge. You're totally worth it. And so making sure that you are doing amazing self-care, that'll be huge. Then, of course, the next step, we want to encourage you. This can feel really overwhelming at times, or you might think, my gosh, it's too late. We've already got kids. But we know that while if you are still pregnant, relaxation is key. Yoga and exercise is good. Massage, acupuncture, a wellness diet, having Dr. Sarver check for toxicities or deficiencies, very, very huge. Movement, exercise, so important for a healthy pregnancy and delivery. But where we start to get concerned is with environmental factors in food, because those chemical stressors start to really affect the nervous system, and they can cause what's called subluxation. And any chemical stressors, emotional stressors, physical stressors, which are many, can cause this subluxation where the nervous system isn't working properly. But when you get checked in an office where we can evaluate your spine and nervous system, and you move often, and you're happy, and you eat cleanly, really, really amazing things can happen. Now, why this is important is that chemical stressors during pregnancy have a huge factor. In fact, researchers discovered 287 chemicals in umbilical cord blood. 180 of these chemicals are known to cause cancer in humans or animals. 217 of these chemicals are toxic to the brain and nervous system, and 208 cause birth defects or abnormal development. It's huge what happens. How we live our life will still affect baby. So a wellness diet is very important. You may not be able to control everything in your life, but you certainly can control what you put in your body. And so we don't get into a whole lot on the wellness diet because we encourage you to be on a proper supplementation program. We have a functional medicine doctor on the team, Dr. Sarver. But it's very important that if you are planning ahead, that you start a wellness diet and a proper supplementation program and chiropractic care 6 to 12 months before conception. You want to eat whole, living, and organic foods. Prioritize healthy fats in what you're eating and supplementing. Make sure that you avoid additives, dyes, caffeine. Those can be really detrimental. And then consider proper blood sugar and sodium regulation. A proper testing and supplementation program will be vitally helpful for you and your family. And then this section, as we wrap up, is going to tie all of this together for you. So it's very, very important that you take the wheel, educate yourself, choose your team, have a plan, stay focused, maintain balance. Life happens, guys. Remember to become the best that you can so baby can be happy. A colleague of mine, Dr. Ron Robinson, who actually is the founder of this entire delivered framework, he said, when mapping the journey of your birth, don't let anyone else take the wheel. And so the question is, are we going to not have a plan at all? Are we going to have a great plan? And are we going to take the wheel? Are we going to choose the right team? Are we going to enhance our experience here? The reason we point this out is because we want to make sure that you have the tools and resources necessary. We know that on average in the United States, 140 pounds of pull is on baby's head in these normal deliveries, and it can be even worse with these augmented deliveries. We've seen so many kids that are born and then they develop ear, nose, and throat trouble, and their immune systems are off, and the colic, and they're not latching on. We see all of this, and it's so addressable. So if you're planning on becoming pregnant, please, let's evaluate your nervous system. We're going to tell you how to do that in a moment. If you are currently pregnant, we need to evaluate your nervous system. We need to make sure you and baby are developing properly. If you already have kids, we need to make sure that kids' nervous systems are developing properly, because that's what controls their immune system, their stress response. It's so vitally important. So it's very, very simple. If you're watching this and it's live, you'd simply email us at care, C-A-R-E, at drlazar.com. And if we get in the next 24 hours an email from you that you're interested in this, we will send you a discount. It'll be several $100s off a nerve scan, which will be great. We also have information for you that we can send you about choosing your birth team. We have different recommendations. We have information on ultrasounds. We have information on vaccines. We have an ideal pregnancy journal you can fill out. So for those of you that sign up for a nervous system assessment, we have all this information for you. And then we have postural advice, specific exercises, stress reduction. And all of us on the team are really, really excited and passionate about getting you checked, getting dad checked, getting baby checked, and making sure that you and baby, you guys have the best chance at life. We know that people invest in tutors and in college and in private school. That's wonderful. But we need to make sure that we're focusing on raising healthy, happy kiddos. And that starts ideally before you're pregnant. The next best time is while you're pregnant. The time after that is within the first 2 weeks of birth. And the next time after that is as soon as the information is made available. Well, if you joined me at the beginning and you heard about Josiah and the $16,000 in bills, and they told us he wasn't going to make it, we called a mentor and friend, Dr. Rick Burns, and he came and saw Josiah in the hospital, and he measured his upper neck and noticed that he had 6 times the allowed amount of nerve interference up here. And so he gently adjusted Josiah's upper neck, and we just prayed for the best. Well, what was amazing was because that was stuck mechanically and Josiah's brain and nervous system couldn't communicate properly, releasing that opened up Josiah's nervous system and allowed him to function the way he needed to. The next day, his lab values were completely normal. It was nothing short of miraculous. The doctors in the hospital couldn't explain it. They said, we were seeing his lab values all over the place and now they're normal. We just don't know what happened. Well, we know what happened. And our vision is that you and your family will have an opportunity to live a healthy, natural, flourishing, vital life. We think you deserve it. We think the problem is that there's too much conflicting information out there. And we're here to clarify that for you and help you and your family live out your full God-given potential. If you're in the Ann Arbor or the Southeast Michigan area and you'd like us to do an evaluation, we have a discount for you. Instead of $453 for that, we're offering, if we get your email within the next 24 hours for this, that's $79 instead of $453 for that full workup. We want people to say, hey, I don't know if I have that or if I need that or we want to make it available for you. If you're not in the area and you want some help finding a place that does some work like this near you, please send that email as well. And that email is care@drlazar.com, care@drlazar.com. On behalf of the team here in Ann Arbor, we really appreciate you. Thank you for being here, and we look forward to serving you and your family very soon. Have a blessed night.